For today, we're doing a fans session. It's just going to be me. And over the last couple of months and weeks, we've been interacting with our subscribers, with our fans, and all of you who've been amazing with your support, which we celebrate so much. And we have a couple of questions that have been asked anonymously, actually, because we are trying to ensure that your privacy is maintained and your confidentiality is kept. And we'll be answering these questions today. Amazing questions we have here. So we'll just be reading the questions, and then we'll be answering these questions. So the first questions we have here is, I was about menstruating and I had sex the same day. Will I get pregnant? Now, the general way to ask this question, the way most people ask this question is, can an individual get pregnant if they have sex during menstruation? That's always the general way to ask this. Now, in this context, hello everyone. Thank you so much for joining us again on the Intimate Matters podcast, a podcast that takes you on a deep dive into the world of sexual and reproductive health. And for today, we're doing a fans session. It's just going to be me. And over the last couple of months and weeks, we've been interacting with our subscribers, with our fans, and all of you who've been amazing with your support, which we celebrate so much. And we have a couple of questions that have been asked anonymously, actually, because we are trying to ensure that your privacy is maintained and your confidentiality is kept. And we'll be answering these questions today. Amazing questions we have here. So we'll just be reading the questions, and then we'll be answering these questions. So the first questions we have here is, please, what is the implications on a rhesus negative woman who had an abortion but failed to take Rogram? Amazing question. This goes to show that you've been following what we've been teaching and what we've been saying, that you're quite very sensitive about your sexual and reproductive health. So let's just take a deep dive into the world of rhesus incompatibility. That when a rhesus negative woman gets pregnant for a man that is rhesus positive, the baby will most likely be rhesus positive, and if the baby is rhesus positive, the mother's body will identify the baby as an external, as a threat, and thereby create antibodies. And when these antibodies is created, it may not affect the first child, but subsequent babies, the mother's antibody will attack the baby that is in the womb, and such a baby will be aborted, or should I say miscarried. So in this case where the person say that the lady had an abortion, this also happened even if you had an abortion. As long as a rhesus positive baby was in that womb, the woman's body will form antibodies. The Rogram that was mentioned by this person is a drug that is being given to ensure that the mother's body does not create antibodies. So in this context, there is a pregnancy, the mother is negative, abortion has been done, and there was no Rogram. It means that there's a very high likelihood, except that baby was rhesus negative. But if that baby was rhesus positive, there's a high likelihood that the mother's body has developed antibodies. And because Rogram was not given, there is an increased risk for subsequent babies that are rhesus positive that will get into that womb. The mother's body will attack those babies, leading to either severe birth complications or sometimes death, which will result in miscarriages. So it's essential that this kind of lady goes to have a Rogram and also speak to a medical professional. We also have an episode on rhesus incompatibility. Do well to check it out. It will really give you clarity on what you should know. Another question we have here is, how can one get back to enjoying sex? Currently, I don't seem to even have sex, let alone enjoy it. I need to solve this as a married woman. Now, this is an issue that is occurring over and over again. Now, this issue is multifaceted. Now, sex is a physiological process and also a psychological process, meaning that it affects the body and also affects the mind. The body may be okay, but if the mind is not okay, it's still going to be a problem. If the mind is okay and the body is not okay, it's still going to be a problem. So for this lady, what I would advise would be, go and see a professional. It's going to take you through the stages by asking you a question. Your history is very, very important. What happened? Has it always been this way? When did it start? Why don't you like it? Why do you feel you don't like it? Is it because it's something physical, or is it that your mindset is bad? Because oftentimes people think that when people don't enjoy sex or when people don't want to have sex, that it's just physical. They may be physically okay. They may have all their sexual and reproductive health organs intact and okay, but they may not be sound psychologically. What if she had trauma? Trauma is also an issue that bring post-traumatic stress disorder. There could have been an issue of sexual assault along the way. There could have been an issue of sexual trauma along the way that anytime she tries to have sex now, the images play back. And when the images play back, her body responds just like it responded at the point of trauma, ensuring that she does not want to have sex or she does not enjoy sex. And this goes out to spouse and to significant others of people who may not want to or may not be enjoying sex. It's essential that you walk with them down the history of their life, their health history, and also their sexual history. Because oftentimes, such persons may have history of trauma or sexual dysfunction in one way or the other. And if these issues are not sorted out, if these underlying issues are not taken care of, such a person may not be able to enjoy sex. I was about menstruating and I had sex the same day. Will I get pregnant? Now, the general way to ask this question, the way most people ask this question is, can an individual get pregnant if they have sex during menstruation? That's always the general way to ask this. Now, in this context, there is no yes or no answer. Yes, it's possible. It can also not happen. It depends on your cycle. What is the length of your cycle? Right? For people who have like the average cycle, 28 days, 26 days, 30 days, 31 days, 32 days, they're less likely to get pregnant if they have sex while they're menstruating. This is because at the process of them having sex, their uterus has not yet, gone through the process of trying to prepare themselves to have a child again or ovulation. But for people who have short cycle, I'm talking about 18 to like 21 days cycle, there's an increased likelihood. Because it could be that the sperm will stay in your body. Because for such people, immediately after menstruation, because their body was already starting the whole cycle again because of how short the cycle is, they just ovulate very soon, immediately after menstruation. So it could be that the sperm may live long enough to fertilize that egg. So it's possible for people that have short cycle, but it's less likely for people with longer cycles. So it's essential that you know your cycle. It will be dependent on your cycle. What is the fate of one on HIV treatment? Amazing question. Because this goes to show that, one, you love yourself, you love your health. That is why you're already undergoing this treatment. Now, HIV is a disease that has no cure, but it's treatable. Now, if you are on HIV treatment and you stick to it, we call it adherence. You adhere to your treatment. You take your drugs as admin due. You go for your checks and the rest of it. You can stay healthy and live a long, normal, healthy life. This is because the drug that you've been given will suppress the viral load of the virus in your body. And when this viral load is suppressed, the virus is not able to attack the immune cells of your body. And at a certain point, as you go on, it will result in what we call U equals U, where the viral load becomes so suppressed that it becomes undetectable and then cannot be transmitted to someone else. Now, when it cannot be transmitted to someone else, it means that if you're a lady, for example, you can get married, have your child, give birth to your child, breastfeed your child, and your child will not have the virus. So it's even possible that you can get married and you stay happily to someone who does not have the virus in them. So it's essential that the fate of someone on HIV treatment is that the person has a good faith. He has a faith that they can live a long, happy, and healthy life if they adhere to this treatment. And it's also essential that people who may not even be living with HIV know this, to reduce undue stigmatization of people living with HIV. These people are normal human beings, and if they take their drugs and get to this point that their viral load has been reduced, when they get to this point, it really, really helps them that they can live a long and happy life. Hello, Geekners. Is it true that men have lower abdomen pain because of not having sex? If yes, what remedy can be done to prevent the pain aside having sex? Now, this is a myth that is as old that is as old as we know it, right? The fact that men say that they feel abdominal cramps and pains if they do not have sex. I want to say it this way. Let me start with something, a phenomenon called blue balls. Blue balls is a phenomenon that occurs when a man has had a prolonged erection without the erection coming down. So when you have a prolonged erection, not forgetting that your penis is a muscle, it's made up of muscles. So just like a muscle is being contracted or stretched for a long period of time, you start to feel aches. For people who do sport and athletes or people who go to the gym, they feel this. When you stretch your muscles for a long time, you start to feel aches. That's the same thing that happens to the penis when it's elongated for a long time without coming down, right? Either through the process of ejaculation or whatever process. And they start to feel a dull, painful sensation. Dull, it's not really a severe pain, just dull pain. This is what is called blue balls, right? So for those, what we advise for people like that is just to get that erection down. It doesn't necessarily mean you need to have sex. You could use a compress, maybe a cold compress, or a hot compress that can reduce, that can bring down the erection, and you'll be safe. But down to this question, is it true that men have low abdomen pain because of not having sex? No, it's not true. If you have low abdominal pain, something else is causing it. It's not because you're not having sex. Go and get yourself checked out. And it's essential that young ladies out there know about this, because most men are using this as a way to coerce or persuade these young ladies who may not want to have sex to finally have sex, because women, being empathetic in nature like they are, may not want to see, especially if it's somebody that they care about, may not want to see somebody they care about going through pain. So they're like, I'm feeling pains on my abdomen, I'm feeling pains. And the woman will want to indulge. No, a man not having sex does not cause abdominal pain. It does not cause. If you're having abdominal pain as a man, maybe you're practicing celibacy, or you're staying away from sex, or maybe you've never had sex before. The abdominal pain is not because of not having sex, it's because of something else. So it's essential that you go check it out. The next question is, if a lady or a woman is still in coma, will she still be seeing a normal menstrual cycle? Or will the coma affect her that she will not be seeing her menses again? Now, when somebody becomes unconscious, there's so many things that can lead to unconsciousness. Now, it will depend on if the aspect of the brain that controls the cycle, especially the one that affects the pituitary gland, which is what releases the follicle stimulating hormone and the luteinizing hormones, all those hormones that are essential for menstruation to occur. If that aspect of the brain is affected in the course of the coma, then there's a likelihood that such a lady will not menstruate while she's in a coma. But if it does not, she'll still do. So you go to, I've been in the hospital seeing ladies that have been unconscious for a while, but when it's time, it still does, because other body system is still functioning. So for example, you see that these ladies are still being fed. If they're unconscious, it's meaning that some part of their body, like the digestive system, is still working, is still breaking down food. They may not be fed solid food, but they will still be given things that will give them nutrients. Right? Because other aspect of their body, some part of their brain is still working. Some of their cells are still working, and they need this energy. So the same thing happens. The reproductive system may still be active, and if it's active, such a woman will still be bleeding. I am a male of 24 years old without sex. Does lack of sex have any effect? Because last month I had a serious pains around my reproductive organs. This is the third time I'm experiencing such pains. What could be the cause, please? So we're going to take this question one by one. Does lack of sex have any effect? No. Now, in fact, if we're looking at effects, because effects may be positive or negative, if you choose to abstain from sex for whatsoever reason best known to you, as far as you do not have a sexual dysfunction, if you're abstaining from sex, maybe because of your religious sentiment, your cultural sentiment, your moral beliefs, or for whatsoever reason, whatsoever it may be, it does not have any detrimental effect on you. In fact, abstinence protects you from so many things. Protect you from unplanned pregnancy, protect you from sexually transmitted infection, and the rest of it. So it does not have any effect on you. Now, about the pain, the serious pains around the reproductive organs, that is not due to lack of sex or not having sex. Except you've had sustained erection, like I mentioned, and blue balls, except you've had that, then we could say it's because of that. But if you've not, it definitely something else. So if it's something like you said, it has been occurring, the third time you're experiencing it, please go check it out. Go to a hospital, go and have it looked at. It is not because of the fact that you've not had sex. Hello, Gignos. Please, can a lady contact gonorrhea? What is the treatment for it? Yes, a lady can contact gonorrhea. Gonorrhea is a bacterial infection, sexually transmitted infection that passes through body fluid. So if a man has gonorrhea and is exchanging body fluid through the process of sex, maybe the semen, as the case may be, he can pass it to the woman, he can transmit it to the woman. The only difference is that gonorrhea is not obvious. The signs and symptoms is not obvious in women like it's obvious in men. Right? So if a man has gonorrhea here, especially the early stages, the whole of this neighborhood will know when he goes to pee because of the painful urination. But it may not be the same for the woman. And that is what makes it look as if a woman does not have gonorrhea infection. She does have it, just that the signs and symptoms may not be effective. So if you're a lady and you get to know, you should be testing yourself for these STIs, especially if you don't trust your sexual partner or you're having multiple sexual partners, or maybe you're selling sex in exchange for cash or favor, whatever it is. Or maybe you're sharing sharps, or you inject drugs and the rest. You should go check yourself out. Maybe you're sharing sex toys, you're sharing dildos and the rest. You should go check yourself out because it can be transmitted. It can be transmitted. And it's a bacterial infection, so there are treatment options for it. There are antibiotics that can be given after appropriate tests have been done, cultural sensitivity has been done, so that you know what is the right antibiotics for you to take. Please don't just feel you have gonorrhea and you walk into any chemist and just collect a combination of antibiotics. You're exposing yourself more to antibiotics resistance or antimicrobial resistance, which will cause you more harm than good. Go to the hospital, get yourself tested, go to a lab, get the test done, and get the appropriate treatment. And follow through with your treatment. Please don't just be that when you start this treatment, just because the symptoms have been allayed or you no more feel the pain like you used to, you decide to walk away from it. It's essential that you take the treatment to the end. So yes, a lady can contact gonorrhea. Yes, there are treatment options for it. Go get yourself treated. So, can pre-cum make a baby even when the person, in quotes, wasn't satisfied? Secondly, can someone with erectile dysfunction, ED, father a baby? Wow, amazing question. Now, getting pregnant does not depend on whether you were satisfied sexually or not. All that is needed for pregnancy to occur is just a sperm and an egg. Just a sperm and an egg. Now, we know with the intricacies of pregnancy, a man will need to ejaculate more so that, it's not all of them that are healthy. It's not all of them that will be able to go meet the egg, but they just need one egg and one sperm to make a baby. So yes, even when you're not satisfied, it's possible. Now, for pre-cum making a baby, it's a yes and a no. Now, pre-cum is a fluid that is secreted by your body to clear the urethra during the process of sex. So when your body realizes that you are sexually aroused, this is for a man, that you arise and you're about to get yourself involved in sex. So what your body does, in essence, is to secrete this clear fluid. Does not contain any form of sperm. It just secretes this clear fluid to clean up the urethra. Don't forget that in a man, the urethra passes both urine and also the semen. The urine is acidic, the semen is alkaline. So if the urine comes in contact with the semen, it may affect the viability of the semen and the sperm. That's the cells inside the semen, which is the sperm. So the pre-cum comes to clean up the urethra, more like you would wash off something before you put in another thing. So it comes and clean it off. Once it cleans it off, before the main ejaculation comes. So pre-cum does not contain sperm. So it cannot cause pregnancy. Nonetheless, in the course where you're having repeated sex, when I say repeated sex, let's say you've gone round one, you want to go for round two. Every time, let's say after ejaculation, your penis goes flaccid. When your penis get aroused again, your body has to produce pre-cum to clean it up. So let's say you had gone like the first round of sex, pre-cum was ejaculated. That pre-cum does not contain any sperm. So you now ejaculated. Don't forget that there may be some particles of sperm hanging around your urethra. It may not be all that has been pushed out. So when you get aroused again, your body has to produce pre-cum again to clean up the urethra. Now, this second phase of pre-cum will come in contact with the sperm that are attached to the wall of the urethra. So this second precum may contain sperm. And if that kind of precum gets into a woman, there is a likelihood that she might get pregnant. So yes, it's possible in such cases for precum to make a baby. And talking about erectile dysfunction and being able to father a child, erectile dysfunction has to do with the fact that a man cannot maintain erection long enough or strong enough, right? So when we're looking at erectile dysfunction, even if the erection is not strong enough or long enough, but there is a production of semen, and that semen has sperm, such a man can impregnate a lady, right? So it is important that you know that erectile dysfunction does not just mean that it cannot. The problem when a man cannot impregnate a lady is when there are issues with the sperm, which are actually the sex cells of the man. But if the sex cells are okay, and for whatever reason the penis can release the sperm to get in contact with the egg, in such cases, it can happen. This user asked, help a sister. I had a miscarriage some weeks ago. I'm noticing breast milk while pressing my breast. Please, is it normal? Yes, it's normal for you to have breast milk coming out from your breast even when you've lost a child. My condolences for your loss, for losing your child. But it's essential to know that when you get pregnant, your body starts to prepare. And one of the ways of preparing your body for the process of childbirth and being a mother is stimulating the breast to start producing breast milk. Now, this has to do with increasing the level of prolactin. Now, the prolactin level works in two ways. It helps to produce milk and also help to impede that the menstrual cycle does not occur. So, depending on the month or how far gone the pregnancy was before this miscarriage happened, it's possible that your breast tissues had already started producing milk and then the miscarriage happened. Your breast tissue does not know that the baby is not there, at least not immediately. So the milk will start falling. But as time goes on, as your body starts to get back to normal, when the product of conception has been expelled and there's nothing to, feed the hormones, the feedback mechanism loop of the hormones leading to an increased prolactin, your prolactin level will fall. And when it falls, the breast will dry off on itself. So that is it. It's normal for you to experience this, but it should dry off. It should dry off in a few days. This question is it medically advisable to make love to her even when she's on a menstrual period? And in a situation where she insists on making love, what would you advise? Now, the issue with having sex during menses, it's very individualized. Talking from a medical point of view, you can have sex during the period, but just realize that you're more at an increased risk because menstruation involves blood, and we know that there are so many diseases that can pass through blood, right? So just know that that's an increased risk, but with the protection of condom and other forms of protection, you can be okay. Also still know that even if you still have sex while menstruating, you can still get pregnant. It's essential that you know this because some people do not know this. They feel that if they have sex during menstruation that they won't be pregnant. So it's essential you know that there's still a likelihood. It may be slim, but there's still a likelihood. So for this question, medically, yes, you can, but know that there's an increased risk. But although some people don't like it because it's not aesthetically pleasing, the fact that the blood will be everywhere, some people maybe for religious or cultural sentiment, if it's against your religion or culture, please stay away from it. But medically, just know that you can go ahead to do it, but there will be implication in the fact that you are more at risk because of the presence of the blood. So that is just the questions we have so far from our amazing viewers and audience. And we're so glad that they're reaching out to us and they're interacting with us. It's always our pleasure to interact and engage with our viewers and our followers. So please, if you want to engage with us, you can engage with us on all our social media platforms, on YouTube, on Facebook, on Instagram, and even on our personal WhatsApp group where you can interact with us and you can ask your questions. And in subsequent times, we'll have opportunities like this where you can ask your question and we'll come on an episode like this and we'll talk about these issues. Our aim on the Intimate Matters podcast is to ensure that you have a healthy sexual and reproductive health. It's also important that you have this information so that you can make healthy, informed choices. We want you to live long and to live well. And on this podcast, being the Intimate Matters podcast, we believe that your intimacy matters, and this is why we have this conversation. I am your host, Akwaowo Akpan. They call me the Gig Nurse, and I'm grateful to connect with you and to also bring this episode to you. And we're hoping that we're always going to see you and you'll always be here to engage with us. Please do well to subscribe to our channel and to like our video. You can share this video to people who may need to see this. And until we come your way next time, this is bye for now.